This podcast is brought to you by eRadio. For more podcasts, check out our website at eradiosa.com or download the eRadio SA app from the Google Play Store. Enjoy.
It's time for Medical Monday on eRadio, and joined as always by Dr. Dylan Joseph. Today, talking about diabetes and the effects on the eyes. A big hello to you, Dr. Joseph. How's it going?
Very well, thanks. Yourself, Eon?
I'm good, thank you. I'm ready for Medical Monday. Interesting topic today.
Excellent.
Suggested by one of our listeners. I think let's just start with the definition of diabetes. What exactly is it?
Diabetes is a systemic disorder, which means the entire body is affected by it. But the main cause is a little organ that is inside our abdomens called the pancreas, which underproduces a substance called insulin. Now, insulin is needed to bind or uptake glucose or sugar in the food we eat, which is then used by our cells in the body as energy. And once that glucose has been used up, it starts getting stored, or excess rather, is stored then in the liver in the form of glycogen. Now, in diabetes, the pancreas doesn't work properly, so it's not secreting insulin into the bloodstream. So what happens is when we eat, we've got naturally high amounts of sugar floating around in the blood, and that unfortunately is harmful for the body. So diabetes is typically separated into two categories, into type 1, and type 1 is generally your younger population, so it's earlier onset of diabetes, and then type 2 is generally your later onset, 50 plus, but often associated with comorbidities like high blood pressure, obesity, heart disease, etc. So yes, I'm certainly not a physician, so I'm not going to get into the systemic details of diabetes, but that's the broad sort of definition of diabetes. And there's a number of different ways in which diabetes is then treated systemically, depending on whether you're type 1 or type 2. But if you look at the data when it affects eyes, the majority, unfortunately, of type 1 diabetics, by 30 years or so, about 90% of those people are going to have some form of problems in the eyes. They may be symptomatic or asymptomatic, and type 2, which is the later onset, has a lower incidence, but we still got to watch that carefully.
And Dr. Joseph, how does diabetes exactly affect my vision?
In a number of ways. So when the glucose levels rise, firstly, diabetics can actually complain of fluctuation of vision, so that things become blurred. Their reading, their distance vision becomes intermittently blurred as their glucose levels fluctuate. And the reason for this is the lens inside your eye, which we've talked about on many episodes prior to this, has the ability to accommodate or change its shape. But what happens with excess glucose in the bloodstream, that gets into the lens as well, and then the lens takes on additional water. So through this gradient, it pulls water into the lens and causes it to swell. So it induces what we call refractive change or visual changes. So the patient becomes either short-sighted or far-sighted, and their vision goes up and down and fluctuates all over the place. They're generally feeling unwell as too. Their sugar levels are high, and generally you monitor this with what's called an HGT, or a finger prick glucose test. But the best sort of long-term monitoring is what's called an HbA1c value that we get. We measure that in the blood, and that gives you a real good idea as to whether their glucose levels are fluctuating very rapidly or whether they're pretty stable and well maintained. So that's one basic symptom, but the more serious complications of diabetes unfortunately hit the back of the eye. And why the back of the eye? Because diabetes affects small blood vessels and the endothelium, or the inside layer of these small blood vessels. So what happens is they eventually start narrowing, and they reduce the amount of oxygen supply to the retina. The retina is an area that is highly vascular, meaning it's got a lot of blood vessel supply, and it is highly dependent on nutrients from the blood. And if we're cutting the supply off, we're starving the retina of its vital nutrients. So diabetes can go through different stages. The two broad categories are non-proliferative and proliferative. So in the non-proliferative, it's the early forms of what we call diabetic retinopathy, or a diabetes that is affecting the retina. So it's either affecting the neurons, which are the nerves there, or the blood vessels at the back of the eye. So we can clinically then see this at investigation, and we can classify you into different categories depending on the severity. We have to then look at this in correlation with your blood glucose levels, and we have to manage this with your general practitioner or your physician. And the main form in the early stages of the disease of treatment is then to try and get really tight control of your glucose, because often you can stabilize this. So a lot of people initially are asymptomatic. In the more severe forms of the disease, you can actually start seeing patches of the retina, which now, because they've starved of oxygen, start dying. So they show what we call cotton wool spots, or little white infarcts. You can start bleeding into the retinal layers. And then in the most severe form of the disease, because the retina is hypoxic or short of oxygen, it actually starts developing very fine, fragile new blood vessels, which can rupture. And unfortunately, when they rupture or bleed, this is a real problem, because it can bleed into the jelly of the eye or the vitreous, and you can have a sudden a loss of vision in the eye, and we can't see what's going on unless we use an ultrasound. And often then you need a diagnostic surgical procedure to remove the jelly, because there's so much blood in it, to see what's going on at the back of the eye. And the other, so that's a real severe part. But more than that, because of these abnormal blood vessels that occur, it starts forming scar tissue at the back of the eye. And this scar tissue crunches up almost like cellophane paper, and then starts putting traction on the retina, on the light-sensitive membrane. And what happens when that occurs? That membrane, or that retina, is basically like wet tissue paper. And if you start pulling on it, you're going to induce tears in the retina and eventually detachments. So the worst form of proliferative disease is where the retina actually starts coming loose from the back of the eye. And this, unfortunately, then requires surgical intervention. Glaucoma is also associated with diabetes in the worst form as well. Because of these abnormal blood vessels that grow, they can actually start growing in the drainage angles in the front of the eye. And it's basically like shoving tissue paper into a drain, but keeping the tap on. And there's nowhere for the fluid to go to drain out. So the pressure goes up in the eye. And these are often refractory to medical treatments, meaning drops and standard forms of glaucoma therapy often then don't work with these cases. And these, unfortunately, end up with big surgical procedures to try and reduce the pressure. And another part of the eye that gets affected by diabetes is the macula. Now, remember, we've also talked about the macula being the area that controls your central vision, so reading, writing, fine detail. This macular area may get affected alone, or it may get affected in combination with the peripheral retina, the blood vessels, etc. And when the macula is affected, and the typical symptoms of that are people start noticing a patchiness in their central vision. They can't read properly anymore. This vertical lines are lying skew, or there's a kink in them. They're lying wavy. That's the typical initial symptoms of diabetic maculopathy. So in summary, it affects blood vessels, it affects the nerves, and it can affect the macula, and it can range from mild to moderate to severe. And it's very important clinically to pick this up and to then be very aggressive with the management.
Dr. Joseph, the damage, is it permanent, or can it in any way or some way be corrected?
Yeah, very good question. In the early phases of the disease, you can control the blood glucose levels by increasing the insulin levels in the blood. And that's in conjunction with your physician or your general practitioner. And often in those mild forms of the disease, we can see regression of these little hemorrhages or bleeds on the retina, those cotton wool spots, or those areas of retina that have died eventually fade. And if it's not in an area that is threatening your sight, then generally, yes, that is reversible and treatable. The mainstay of that in the early forms of the disease is tight control of your glucose. But once it starts affecting the macula, once you start developing these fragile blood vessels that bleed, this unfortunately often results in permanent damage to vision, and then it's about trying to save what's left, sadly. But very often, people who are in this phase of the disease have got very poor control of their blood glucose, and it's often not the fact that the blood level of glucose is high, but more the fact that it fluctuates. It goes up and down and up and down and up and down. That actually does the damage to the eye.
Yeah.
And then it's just maintenance. Then we've just it's damage control. That's what we've got to then try and look at.
Okay, and can diabetics still have laser or cataract surgery, Dr. Joseph?
Yes. Look, we need to get tight control of the diabetes first, and obviously manage it as best we can. There's a number of treatment modalities which we'll discuss just now on how to look at making sure that we get as tight a control of the eye manifestations as possible before considering cataract surgery, because unfortunately cataract surgery can exacerbate, for example, the leakage of fluid in the macula in diabetic edema. And if they've got well-controlled diabetes, it's certainly not a contraindication to laser vision correction. So we've got to have a thorough examination, look at what their visual acuity is, meaning what are they seeing and what is their best correction that they're seeing. And if all looks good, and if they're well controlled, we can certainly proceed with cataract or laser vision correction surgery. Sometimes in diabetics, unfortunately, one of the complications with diabetes as well is premature cataract formation, and this can obscure the view of the back of the eye and sometimes delay our treatment processes. So in those cases, we may be forced to do earlier cataract surgery, even though the diabetes is not well controlled, just to make sure we can see the back of the eye clearly.
So, Doc, I think, I hope we covered all the questions that our listeners had today regarding the effect of diabetes on the eye. But if there's anything else they would like to know or get in touch with you, how do we do that?
Well, I think there is one more thing that in terms of the treatment, Eon, that we can quickly run over, which, because it's such a broad area that affects the entire eye. Yeah. Treatment options for diabetes when it comes to the eye. One is cataract surgery. Two, if we start seeing that there's leaking blood vessels at the back of the eye, we can actually do laser to the back of the eye. It's a very specific laser. It's called an argon laser. And you actually coagulate those blood vessels, and you switch off the blood supply to that area of the retina so it can't form new vessels. You can do soft laser around the macula as well to stop it leaking fluid. And our mainstay of therapy, actually, what we do for most diabetics when they're either leaking blood vessels from new blood vessels or they've got edema or fluid in the macula, is something called an anti-VEGF injection into the eye. So an anti-vascular endothelial growth factor injection. Now, there's a number of different brands that we use and different frequencies that we actually inject these substances into the eye. But basically what it's doing is it's mopping up the fluid at the back of the eye and drying up the excess blood and trying to really extract the fluid from the macular area to try and improve best corrected vision. And often on most of the diabetics, once you start injecting, end up with between 9 and 17 injections if you look at the statistics over a 2-year period. So that's our sort of main modality of treatment, apart from laser, and then of course cataract surgery if they develop cataracts, and then what's called a vitrectomy, removing the vitreous if there's a lot of blood in the vitreous, and then retinal detachment surgery, unfortunately, in worst case scenarios when the diabetes is so bad that it actually starts pulling the retina loose. So those are our common approaches. In refractory cases as well, you can use steroids, inject steroids into the eye to try and control the leakage of fluid in the area that controls the central vision, called the macula. But we have a phased approach to this. And once you start treating a diabetic, they are in the practice for a long time in terms of the treatment. But the biggest thing is they really need to adjust and modify their lifestyle, their dietary factors, their comorbidities, and get tight control of their glucose. Interestingly, there's a number of modalities that we're looking at now, introducing into practices that uses artificial intelligence. So we take a fundus photograph or a photograph of the back of the eye, run it through the artificial intelligence, and actually that can stage the diabetes for us. And it prints out a diabetic report, which then can automatically get emailed to the general practitioner or the physician. And the ophthalmologist has a treatment program and keeps the physician and the general practitioner in the loop as well. So, there's a lot of great advancements in that field, and co-management is really important. So, it's a big area. You're in a big area. But if you think you've got diabetes, or if you have got diabetes, just make sure that you're checked out by your general practitioner and your physician, your local ophthalmologist. To answer your last question, we're based in Knysna, and you can get in touch with us via either our website, which is www.drdillanjoseph.com. Our local landline number is 044-150-0085, and Mariska can help you there. And we've got a YouTube channel going, and we're on a number of social media platforms as well, including Facebook and Instagram. And you're welcome to check out our stories there, and we're often posting about different eye problems on a weekly basis.
Yes, and also interesting chats with patients, which I really enjoy watching. That's really cool. Thank you, Doc. Fantastic. That was another very insightful Medical Monday. Thank you, as always, for your time. And then until next week.
Absolute pleasure. Yeah, perfect, Jan. Have a good week.
You too. Thank you so much.
Okay. All right. Cheers, Jan.
This podcast was brought to you by eRadio. For more podcasts, check out our website on eRadioSA.com or through the eRadio SA app from the Google Play Store.